Hello, ladies and gentlemen. Thank you very much for joining me here today in my clinic in beautiful Ojai, California. Today's subject is understanding autoimmune conditions. It's very important to understand the underlying causes of an autoimmune condition. And of course, we're going to talk about it to some degree based on the Ayurvedic perspective. We're just going to use more layman terms and simplify it so you can understand. So it doesn't matter what autoimmune condition you have, understanding these concepts of understanding what's happening with your immune system and why is your immune system overreacting and why is your immune system attacking your tissue and what type of foods and things are you doing in your life that could be overstimulating your immune system and aggravating and even leading to this condition. The ultimate cure is to modulate the immune system, and this is usually done with herbal remedies specific to the type of autoimmune condition. But there's an overall concept that has to be understood when you have an autoimmune condition. And really, there's no direct words and understanding of autoimmune conditions in Western medicine. So Ayurveda has a very clear understanding of them. I've been very successful in treating a wide range of autoimmune conditions, but the concept of how to do it is what's very important. So we will have to use some Ayurvedic terms, which I'll explain. So first of all, the first term we really need to learn is called ojas. Now, this is often translated over to the word immunity or resistance to disease. But ojas is very deeper than that. It's your resistance, your inner strength to avoid infection, to avoid pathogens. Now, of course, from the Western perspective, we talk about the T cells and the antibodies and, more at a microscopic level. But in Ayurveda, they talk more about the conceptual state of ojas, even though you can't measure it, you can't see it in a microscope. An Ayurvedic doctor is clearly able to determine how much ojas or resistance that you have. And of course, if you have a long history of catching flus, getting diseases, getting infections, whether it's toenail fungus, what's urinary tract infections, colds, flus, then we can assume your ojas or your resistance to disease is low. So we're going to talk about this first and understand how to build your ojas, how to build your resistance. And even before how to build it, we're going to talk about how to avoid depleting it. Because in an autoimmune condition, there's two major factors going on that you have to understand. One, there's the depletion of the ojas, a depletion, a weakness in your immunity, we could say. And we're not just talking, T cells and antibodies. We're talking at a core level of ojas, which some ojas is inherent in the individual based on the prakriti, and other ojas is acquired. So, and then the second half is your, in Ayurveda, they call it tejas. Tejas is like the essence of pitta. Pitta is the fire that's your metabolism, that's digesting food, that's heating the body, that's keeping the blood warm, that's giving you the spark, giving you the intelligence, giving you the focus, your pitta, your drive, your fire. But this is the tejas, which is the essence, or we could say not the flame of the pitta, but the heat or the warmth of it. It's more subtle. Just like ojas is the deep subtleness and refinement of kapha, tejas is the refinement of pitta. So this is where it gets a little tricky, but let me try to explain. So pitta is metabolism. So, it's the pitta that attacks the pathogen. It's the tejas is at a cellular level that attacks pathogens. And, we could say this is your antibodies, that are attacking the pathogen. And we could say that's the tejas, at a cellular level, tejas. If you have acid reflux and heartburn and body heat, this is pitta. in the digestive system, Panchaka Pitta. And if you have a red in the eyes, this is Pitta in the eyes, Alachoka Pitta. But we're talking a more refined Pitta, which is called Tejas. And Tejas is responsible for the strength of your immune response. So there's the Ojas, which is the resistance, which is dense, white, solid, stable, and we could say like the essence of kapha. And then you have the Tejas, which is that part which is doing the, we could say the attacking, the destruction, the fighting of the actual pathogen. So in autoimmune conditions, we always have two factors we can be sure of. Tejas is too high, which is usually supported by high Pitta. And Ojas is low, weak. That's the fundamental. All autoimmune conditions, we have this. So we always are building the Ojas and avoiding things that deplete the Ojas. And we're modulating, cooling down the Tejas. We could say the immune system. We're modulating the immune system. So it's not attacking your tissue. And then the other hand, we're strengthening your tissue. So let's go back to the Ojas, your resistance, because your tissue, whether it's psoriasis attacking your skin, whether it's pancreatitis attacking your pancreas, whether it's diabetes type 1 attacking your pancreas, or it's Crohn's condition, or ulcerative colitis, or inflammatory is attacking your colon. The concept's the same. It's just it can happen in different parts of your body. But that means that part of your body has low Ojas, low resistance, and simultaneously the Tejas is too high. And it has to be modulated. So this is the fine tuning, the adjustment. There's no such thing as, oh, here's the cure for Hashimoto's. No, it doesn't work like that. Here's the cure for psoriasis. And if you see my testimonials, you can see that I have many people that say, oh, I cured them of these autoimmune conditions. No, I didn't cure them. I balanced out, increased their resistance or Ojas. I modulated their immune system using herbs for the modulation, and generally using food to bring up the resistance and build the immunity. So I used both herbs and food to find this balance between these two, to tone down the Tejas, tone down the immune system, and build strength and resistance. So we'll start over there with resistance first, the Ojas. How do we deplete our Ojas? How do we make our immunity weaker? Not modulated, but just weaker, so we end up getting sick more. Well, one, skipping meals, detoxing, fasting, and being underweight. These are the most common signs of a depleted person. They're underweight, they're bony, their bones are sticking out, their collarbones sticking out, cheekbones are sticking out. They got the six-pack sticking out, so they're depleted, they're weak, and they're not having much fat in the diet. The skin is thin. There's not much fat. So this means the membranes of the cells aren't very thick. There's less resistance. There's less fat on the body. There's less fat on the cells, less fat on the skin, because this fat is part of the protection or membrane. Many people, of course, have a bad idea of fat. They don't realize that it's providing protection, just like your rear hind, your butt, is providing protection. So when you sit down, you're not sitting on your tailbone. If you're hitting your tailbone, and then you don't have enough fat in that area of your body. So fat is very important, and it is protecting the body externally. It's protecting every cell, and it's building Ojas and resistance. So all Ojas building substances are usually are fatty and oily, and ghee is considered one that builds Ojas. And we have different formulas in Ayurveda, like Chawan Prash, which has, herbs like amlaki, and it's put in ghee and honey. Honey builds immunity, ghee builds immunity, strengthening builds immunity, and even exposure to pathogens builds immunity. For example, people who are too sterile and washing their hands and avoiding infections, even particularly in childhood, then will have a weaker immune system than somebody who's been exposed to more pathogens, and they build up, of course, we know what they're building up. They're building up the antibodies. But in Ayurveda, we're building up the ojas, the resistance to disease. So these are the things that you have to try to avoid when you have an autoimmune condition. Many people are trying to detox out of an autoimmune condition. No, I mean, there can be toxins in the joints, like in rheumatoid arthritis, that can be the trigger that's making the immune system attack, because the toxins in the joints, and these need to be cleared. There can be toxins in the liver. There can be toxins in the body that are creating the trigger that's making the immune system over-respond. But when we have an autoimmune condition, we're really assuming that the system is responding, attacking the tissue, even when there's no toxin there. This is what makes it unique, and it's not stopping. So it's an unmodulated immune system that's overly active and overly aggressive. So building, not depleting yourself, is the key to having good immunity and strength. If you want to just live off of coffee and smoothies, you're going to have low immunity. You may lose weight and be very thin, look good in a bikini, but this doesn't mean you have strength and endurance. People who are tired and fatigued easily in the afternoon, usually have lower immunity, weakness. So we have to build the person. Unless they're overweight, then of course it's a different situation. But if they're underweight, thin, weak, tired, frail, and get sick easily, we have to build immunity. We can do this with herbs. We can do this with diet. And then second, we have to modulate, bring down this overly active immune system that's attacking your tissue and destroying the organ in some cases, like pancreatitis or diabetes type 1 or psoriasis, where it's attacking your skin, attacking your organ. So we need to modulate it. How do we do that? Well, we have immune modulating herbs like Amlaki, Rasiana, Guduchi Sattva. We have those covered in another webinar where we talk about specific herbal remedies for specific autoimmune conditions. But first, we want to make sure with the patient it's not overstimulating their immune system. This is very important. Just like we don't want to deplete, the person shouldn't be depleted and weak and frail. They need to be strengthened and build up. And at the same time, then we have to make sure they're not overstimulating themselves. And that's almost always the case. What's overstimulating your immune system? Well, things that are immune stimulating. For example, honey, mushrooms. Many mushrooms are very powerful in building your immunity. But I've seen many people with autoimmune conditions doing mushrooms every day, different mushrooms, cordyceps, reishi, the lion's mane. I mean, lion's mane would maybe be the exception there. But when you do a formula mixed with mushrooms, you're obviously getting a boost of energy, a boost of your immunity, and a boost of your strength. And for many people, this can be very beneficial. But for people, this is overstimulating an immune system. Often people with very strong immunities don't have any sickness or don't get sick. People a lot of times with certain like psoriasis or allergies, their immune system's overreacting. An allergy too, the immune system's overreacting. So you notice these people aren't getting ill very often. They're not catching the common cold very often, but they're getting itchy and their immune system's a little bit overreacting, and they may have some autoimmune condition that's not quite managed. So often people with very strong immunity have to be very careful not to take too many immune boosting things. Zinc, honey, mushrooms, echinacea, many herbs can overly stimulate your immune system. So I have people who have come to me, were taking Chinese herbs on their own, and I felt these would maybe overstimulating their immunity. Mushrooms, honey, all these need to be reduced. And other things like a lot of fermented foods, because the underlying aspect of a strong immunity is strong. There's two aspects of it. There's the kapha part, the ojas, and then that aggressive part of your immunity, the aggressive part, pitta. That comes, if it's too strong, then we have to reduce the pitta down. The underlying doshic imbalance has to be managed in all cases. You have to look at the person holistically. You can't just say, okay, here's the herb that doesn't exist, here's the formula. No, each person will still be different. So we have to, in a lot of cases, the pitta's too high. There's red skin, there's burning, there's red eyes, there's strong appetite, there's acidity. We know that pitta's too strong. We have to bring down the pitta, manage the pitta, because the essence of pitta is a tejas. And when we see pitta's high, we know tejas is high. If tejas is high, we know the assertive or pitta aspect of the immune system is very strong. And and then they have the rash, they have the itchy, and they have the autoimmune condition as a result. So that means we have to balance pitta. No spicy foods, no hot foods, no chili peppers, and a lot of fermented foods. Fermented foods like kombucha, sauerkraut can stimulate your immunity, and they create heat, just like honey. It creates heat. And so these stimulating, heating, fermented foods have to generally be all eliminated. And of course, things like tomatoes, eggplant, bell pepper, which also increase pitta, generally are reduced in most cases, at least to some degree. So it's a balancing act. We have to bring down the pitta, modulate the immune system, bring up the ojas, which is balanced by kapha. So, and if vata is too high and the person's all nervous and anxious, this can also push the pitta up, kind of like the wind is the vata and the pitta is a fire. So the strong wind makes more fire. So sometimes vata also has to be managed. Autoimmune conditions similar to a cancer, you generally have an imbalance of kapha, vata, and pitta. The kapha is the depleted immunity like ojas. The pitta is the overly active tejas or pitta, and vata could be involved as well, stimulating this pitta. So you need to make these adjustments. So that is always the first step, is to balance out the immunity, that it's strong and resistant, but not overly active, not overly aggressive. Modulate the immune system. And fortunately in Ayurveda, there's many herbs that just are known to be immune modulators. There's plenty, Amlaki rasiana, which is the dried juice of the amla berry, Guduchi sattva stem, the stem of the Guduchi plant, dried, and then the remaining, and then cooked, and then the remaining film on the top is scraped off and made into a little white powder. And this is also known as a very effective immune modulator, dropping down the power and strength of the immunity without reducing its resistance. Because, of course, the medical world is going to want to use steroids, which are immune suppressing, which make you more vulnerable for other type of disease and never really resolve the issue. It's forcing down the immune system, and you become dependent on the medication. Here, the immunity is like a crying baby, and we're calming it down. And once we get the immune modulated and calmed down, then we can avoid these foods and herbs that will overstimulate the immune system and keep it calm and keeping pitta balanced, building up the resistance on the other side. So this is the first step in immune system, and then on an autoimmune condition. And the second is, of course, addressing the tissue that's involved. If you have psoriasis, there'll always be some herbs for the skin. If there's, it's in the colon, like in Crohn's, or then there'll always be some herbs for the digestion have to be involved. So there are hashimoto's, there will be herbs for the thyroid gland. So you're treating the tissue and the immune system simultaneously. And third, you're treating the doshic imbalance of the individual. So if I give you a formula, there'll be three parts of this formula. First part of the formula would just be balancing and modulating your doshic imbalance. If you're pitta, we're going to get a lot of shatavari and kamaduta. If you're ashwagandha, you're going to get dashamula and ashwagandha and vidarikan and kapha, vata balancing herbs. And if you're kapha, you're going to get pipali and punarnarava, kapha balancing herbs. So first part of the formula always must balance the dosha, and the diet too, the prakriti. And then the vikriti is the imbalance. In this case, autoimmune condition, the pitta is too high. So we have to balance that, as we said, with immune modulators. And the third level is we have to actually help and support that tissue that's been damaged. I mean, if you have psoriasis and your skin is being damaged by it, then you want to put in herbs like mangista that help to heal the skin and support the skin. So, and if you have Hashimoto's, then you have to put herbs that we know are supportive of thyroid function. So there's three aspects of any formula. That's why every client will be very different. One, for the doshic imbalance, the holistic aspect of the person, because we need to balance Vata Pitta Kapha, and then something for the tissue involved or the organ that involved, and then third, what we said here, and that's to modulate the immune system so that it is modulated, toned down, and kept down. So, and it can take within just a couple of weeks to modulate it. But with the herbs, they're very effective. But to keep it modulated can take months and months of taking the herbs until the immune system is almost like retrained to stay modulated. So I hope this gives you hope that there's great possibility in treating all autoimmune conditions if you have a practitioner, an herbalist who's advanced enough to make these custom formulas. I have over 400 products, and I don't have one product for autoimmune conditions because they're all so unique that generally I custom make them for every single individual. And even you come back to an appointment after 1 month or 2 months and there's progress, I'll make the formula different as you're progressing. So please get out of your mind this concept, oh, what do I take for my Hashimoto's? What do I take for my celiac? What do I take for my rheumatoid arthritis? No, this is not the right thinking. First, you should start thinking, what am I doing that's depleting my immunity, like ojas? And what am I also maybe doing to overstimulate my immunity, the tejas, which is creating the environment for this condition to exist? That's the first thing you need to think of. And that's what, as a practitioner or Ayurvedic doctor, that's what I have to understand to proceed, is to help you eliminate the causes that you are doing daily. Could be coffee, could be chocolate. Chocolate's inflammatory. You got a rheumatoid condition, you've got inflammation, you've got the immune system overreacting, attacking the joints, so tomato sauce is removed, hot spices are removed. These are depleting. Anything, fermented foods are removed. And things like ghee and some types, even mild cheeses, are actually added in certain cases if the person is frail and weak and depleted, and their tongue is pink and raw with very little mucosa. So every person is treated separately. And as you progress and you're getting better, then of course the herbal formulas change as you're changing. So it's very important to understand this. The herbs do not give you instant results overnight. If you take a steroid, maybe your inflammation, your inflammation for your autoimmune condition can drop very quickly. But once you stop the steroid, then it's going to come right back. Herbs don't work like that. You have to change your diet, get rid of the causes, because you're causing it to some degree. It's nice to blame your DNA and your grandparents because they had the same condition maybe, but you are generally doing something every day that's aggravating this condition, either depleting your immunity, overstimulating your immunity. And this needs to be rectified first, because that's the most important treatment. Remove the cause. And most people are causing the problem. Always. Unless it's a baby who's being nursed, and then we know that's the mother's diet and the mother's habit that's affecting the nursing child. I've treated nursing children by treating the mother, and then the treatment went through her milk, and the changes she made to the diet then improved her milk. So in everybody else's case, what you're doing, what you're eating is a major, major factor. So that needs to be changed. And then the second stage, removing these causes, is to build immunity, modulate the immune system through herbal remedies. And you take them gradually, and it gets better. For a client who comes back after 1 month, I'll ask him, how much better is your pancreatitis, your rheumatoid arthritis, your celiac. And they may say only 20, 30% better, but it's clearly getting better. That's the way it works. So we take more herbs. Maybe I change the formula. Maybe we change part of it, and they keep going another month, and then it's 50% better. Another month is 75% better. And then we reach a point where it's 100% better. We're seeing no signs of it. And of course, they can go get tested and check, their inflammatory markers with the doctor to see that these have been reduced down until the point where the doctor no longer sees them as having an autoimmune condition. And that could take anywhere from just a few months up to 1 year. So you have to be patient. You have to keep going. You have to follow the diet during the treatment. You have to keep taking the herbs. There's no quick fix. We need to get that out of our head. There's no pill or shot that's going to boost your immunity. You either have the immunity or you don't have the immunity. And if you're depleting yourself with things like alcohol, over-exercise, overwork, stressing, not sleeping, skipping meals, or eating poor food and junk food, then you're generally going to have low immunity. No pill, no herb, no shot can boost your immunity. You need to address it in a holistic manner, in the natural manner, to have real strength and endurance and we could say a defense against these pathogens. Okay, so please contact me if you need more assistance. I hope this helped you to some degree to understand your immune system better and to realize that your immune system can be modulated, and there are immune modulating herbs available and formulas. It's something that really needs to be made custom by a very skilled herbalist who has a very large selection of herbs, and that each person would receive individualized treatments based on what autoimmune condition they have, what stage they're at, and other factors, even including the weather. So hope this gives you hope. Hope this helps you to some degree, and feel free to contact me if you need further assistance. Thank you very much, ladies and gentlemen.